For the past few months, we've been studying healthcare. More importantly, we've been studying how certain healthcare systems around the world affect women. We focused our research on the healthcare systems in Canada, Saudi Arabia, the United Kingdom, Switzerland, India, and the United States of America. From our research, we were able to come up with 3 solutions that we think will be very beneficial for healthcare systems all around the world. Our solutions are to provide better healthcare education in rural villages and communities, to provide universal healthcare, and to provide better access to healthcare in rural areas.
The amount of girls who have little to no health education is staggering. Even in more developed countries like the United States, female health education is lagging behind. Girls should have enough of an understanding of their own anatomy in order to take good care of themselves and be able to detect if something is wrong. In the Middle East, women are very restricted when it comes to taking their health into their own hands. The male guardianship system that is practiced in Saudi Arabia prevents women from doing many normal things like traveling, driving, and even accessing healthcare without permission. According to Human Rights Watch, this system likens adult women to minors. Therefore, a culture of staying silent about health concerns has developed among women, most specifically in the Middle East. However, we see this in other parts of the world as well. It even still happens in places like the United States. Yes, maybe on a smaller scale, but many women do not come forward when they are experiencing health difficulties for fear that they will be seen as weak in their society's eyes. However, this is more dangerous in areas of the world that have little or no health education for women, since they could be facing a serious illness without even knowing it. According to a study done in Egypt in 1999, 50% of the women who participated had a reproductive tract infection, 56% had a genital prolapse, and 63% were anemic. After the study was performed, these women were asked why they did not voice their concerns, and they all responded that they thought it was normal. These are conditions that could be easily treated, but if they are not brought forward within a timely manner, they can become serious health concerns. Part of the problem is that women don't feel comfortable coming forward with health concerns because there are not enough female doctors for them to confide in. Women want to be able to speak to another woman about female issues, and they should be able to. Women should always have a thorough knowledge of their bodies and a safe environment in which to ask questions, as that is essential for them to live a happy and healthy life. So, my solution is to create an opportunity for better female health education in rural villages and communities. The way I would accomplish this would be to create programs which educate girls about their bodies and establish clinics in remote areas in order to give women a much-needed resource that they probably didn't have before. A program in India called It's My Body has a similar goal. It is an after-school program which educates unmarried girls from ages 12 to 16 about sexuality, sexual and reproductive health and rights, and life skills. It is split up into 20 sessions in the span of 10 months, mostly in rural and semi-urban settings. This program also informs the girls' parents of what they will be learning, since that can be a point of contention in countries like India. Women and girls need these kinds of resources in order to stay healthy, so the least we can do is help girls understand and appreciate their own bodies.
Next, a very controversial subject is universal healthcare. Countries such as the United Kingdom and Switzerland offer universal healthcare for their citizens. While the healthcare in these countries may have a few flaws, they are very advanced when compared to countries who don't offer universal healthcare. Unlike the United Kingdom and Switzerland, some countries such as the United States have yet to offer universal healthcare. After researching 2 countries whose universal healthcare has resulted in many benefits for women, I believe that providing universal healthcare is the best way to go. Women in the United Kingdom and Switzerland have many healthcare benefits due to the fact that it's universal. For example, women in the United Kingdom don't avoid hospital care due to high prices. Instead, they can go whenever they need to because the cost is covered. Therefore, they have access to it at all times. Along with this, the United Kingdom has some of the highest success rates when it comes to labor and deliveries. Since they prevent hospitals from getting too crowded, home births and birthing centers led by midwives are very popular in the United Kingdom. This is a very successful system, and it is very reassuring to know that these women have access to hospitals if something were to go wrong. As for the women in Switzerland, all citizens are required to buy health insurance, and as a result of this, Switzerland is known as one of the best places to raise a girl. All women in Switzerland have access to healthcare no matter what their age or medical history may be. Along with this, those who need it are given some sort of subsidy from the government to help cover their health insurance. Lastly, the universal healthcare in Switzerland has made it possible for all women to have access to crucial things such as abortions and maternity leave. It's very obvious that women who live in countries that provide universal health care have many benefits. In order to ensure that this is the case for women all over the world, the UN should introduce universal health care to countries who don't already provide it. In order to do so, I believe that the UN should step in and help build healthcare systems like the one in Switzerland, which I believe is the most efficient.
So you're poor. How do you buy health insurance? Well, instead of being stuffed into Medicaid, which is a very degrading program because a lot of physicians will not see Medicaid patients because they're so poorly paid, in Switzerland, the poor get enough money so that they can go and buy health insurance like everybody else. Suppose you're really sick. Will any insurer want to give you health insurance? Yes, because the Swiss insurers have formed a reinsurance pool. So here's how it works. If I were a woman in Switzerland, in Zurich, I would pay the rate of a woman my age, middle 30s, and the insurer would have no knowledge of whether I'm sick or not. Now, sir, what is your name? Yeah. Bill. So let's say Bill got me and I'm very healthy. He would make a fortune. What is your name? Steve. Let's say Steve is a different insurer. He got me and I'm very sick. He would lose his shirt. Steve is going to do everything he can to avoid insuring me, except Bill and Steve have formed a reinsurance pool, and here's the deal. They take the profits that Bill has earned for no good reason other than he's a nice guy, but he didn't deserve this. He earned it only because he got a healthy person who was paying the average rate. They take those profits and they give it to Steve, which ensures that, number one, sick people pay average prices, and number two, the insurance companies are interested in insuring sick people.
The UN would help countries set up private insurers to provide health care. People would have the option to choose which plan is best for them. This way, since it's not led by the government, is the best because the system is consumer-driven and ensures that high-quality care is provided at low prices. In conclusion, providing universal health care would be a huge step forward for women. This way, all women would be guaranteed health care, and they could live their lives knowing that if something were to happen, such as getting sick or having an unwanted pregnancy, they can be treated without having to stress about not having health care.
Immediate health care is very hard to reach for many women, usually because of proximity or social obstructions. For example, in India, many women in rural areas are not being helped the way they should. Tuberculosis is one of the leading causes of death in many areas. Many women are dying from this disease because of a lack of clinics and hospitals, as well as the stigma surrounding the disease. Women themselves are often blamed for contracting the disease. Tuberculosis is the 5th leading cause of death in women in India. Because women are often not taken to clinics until it is much too late. Although many women in India are studying medicine, very few become doctors. Women make up 51% of medical students and only 6% of rural doctors. Additionally, women are taught not to be treated by male doctors, so they have no one to go to. Maternal mortality has also become a large problem in India. In 2009, Human Rights Watch said that India is one of the worst places to be a mother. India has the highest maternal mortality rate, or MMR, in the world. One reason for this is the lack of adequate hospitals and healthcare clinics. Thankfully, in 2016, India's maternal mortality rate dropped by 5.7% and has been slightly improving before that. But that does not mean that this rate is okay. The mortality rate is 212 deaths for every 100,000 births. In America, for many women and families in rural areas, the only source of health care is from Planned Parenthood centers miles from them, and even then, Planned Parenthood is at risk of being defunded. 78% of Planned Parenthood patients are under the poverty line, and half of Planned Parenthood centers are in underserved areas. Besides Planned Parenthood, 81 clinics were shut down by the government in 2015, making centers much more sparse. Also in 2015, the government tried to cut teen pregnancy programs. 4 in 10 women say that Planned Parenthood is their only source of health care, so without Planned Parenthood, these women would no longer have a source of health care. We as a society need to take action and make healthcare more accessible to women in rural areas. This can be done by training more female doctors who can reach these areas. In India, 70 to 75% of doctors are based in urban settings, and due to social norms, many women cannot be treated by a male doctor, but there is a lack of females in this area of work. Another way we can fix this problem is by encouraging countries to better fund healthcare clinics in rural areas. An example we can follow is an organization based in India named Shopal. This organization has seen over 600,000 patients in rural areas, and each physical only costs $1. Because the founders of the organization believed that healthcare needs to be more affordable.
We thank the UN for taking the time to listen to our solutions. We hope that you consider our solutions to ensure that women all over the world have access to the best possible healthcare.